Good morning, everyone. Welcome to our first featured session of the 2021 Smart Start Conference. I'm Amy Cubbage, and I'm president of the North Carolina Partnership for Children, and we are very glad to have you back with us. These panels, these featured sessions, give us an opportunity to dive more deeply into some of the most important issues facing early childhood in North Carolina, and to hear from some of the preeminent experts in the field. During these sessions, we will explore the policy landscape for early childhood at the state and federal levels and ways to support the early childhood education workforce. And today's session, we will begin with a look at the unique needs and challenges faced by early childhood systems, providers, and educators in our rural communities, as well as the strategies successful in supporting children and families in rural communities. This session and the topic for this session really grew out of discussion with our local partnerships as we work to better serve and support rural communities through our Smart Start network. With 80 of the state's 100 counties classified as rural, these diverse communities are key to our state's future. As we explore this topic and all the featured sessions, we will include a focus on equity, understanding the importance of centering our work with young children and families in and on equity. Today, I'm pleased to welcome our panel of leaders with a variety of perspectives and experiences. I look forward to learning from them, hearing from them, and hearing your questions and ideas as well throughout this discussion coming up. Please join me now in welcoming our moderator for today, Seth Saeugling, co-founder of the Rural Opportunity Institute. Seth?
Thanks so much, Amy. Really grateful to be with you all this morning and grateful to have the opportunity to spend the next hour together. I live and work in a rural community. I am located in Nash and Edgecombe County in the eastern part of the state. The Down East Partnership for Children is our local Smart Start affiliate, and really excited to dig in today. The purpose of our panel is we're going to dig deep into the unique challenges and opportunities that are facing rural communities in early childhood care, and we're going to take a special focus on equity. Our amazing panelists today are going to share their firsthand experiences in providing services and support in rural communities, as well as explore opportunities for support and engagement. And just for a rough outline of our time together, we'll kind of start out today digging into the assets of rural communities. We'll then transition into talking about what's at stake and what are the rural needs. Then we'll follow that up with trying to identify what's the collective opportunity. What are any specific strategies we can walk away from this session today with to better advocate and support more resources flowing into our rural communities. And then we'll close out with questions and next steps. And so with that, I'd love to turn it over to our panelists. And Magda, if you want to start with introducing yourself.
Good morning. Thank you, Seth. I'm Magda Baligh, and I'm the executive director of the Halifax-Warren Smart Start Partnership for Children. Halifax-Warren, the counties of Halifax and Warren were located between I-85 on the west and the Roanoke River on the east, which is past I-95, right at the Virginia border. This is a rural area, and our two counties combined have a population of about 73,000 people in an area that is larger than Wake County, which has a population of 1.1 million people, to give you some perspective. Thank you.
Thanks, Magda. Todd?
Thank you, Seth, and thank you to the Smart Start team for inviting us all here today for this really important conversation. My name is Todd Brentley. I'm the Vice President of Public Affairs at the NC Rural Center. The NC Rural Center works in our state's 80 rural counties doing economic and community development. We've been around for about 34 years, so we've been in the space for a while and have seen a lot of changes and progress made, as well as new challenges for these rural communities to face. We work in leadership, small business lending, program and community and engagement throughout the state in various forms. And we also do a lot of policy and advocacy research work as well. So it's great to be here, and I'm looking forward to this conversation, Seth.
Thanks, Todd. Khari?
Thank you. Good morning, everyone. And I want to say thanks again also to the Smart Start for having me to be a part of this this great discussion. My name's Khari Garvin. I'm the Executive Director of the Head Start Operations for Save the Children Federation. And we operate 6 Head Start programs in 4 states and in rural communities in each of those 4 states, which include North Carolina, Arkansas, Louisiana, and North Dakota. So it is my great pleasure to be here, and I'll give it back to you, Seth. Thank you.
Thanks so much. And Mallory?
Hi, good morning, everybody. I'm Mallory Warner-Richter. I'm a research scientist and the deputy lead for equity, quality, and access at Child Trends. Child Trends is a national nonprofit, nonpartisan research organization, and we're dedicated to improving the lives of children and youth. I work in our early childhood team, but we have teams that study all through the course of childhood and young adulthood. And I'm really happy to be on the panel this morning. I was asked if I could provide a couple of quick kind of headline facts about rural early care and education that I thought I would share now, and then we can keep coming back to these points of data as it's useful during the conversation. So what we know about young children and their families in rural areas, there are across the nation about 1 million households with children under the age of 5 that live in a rural area. We also have a sizable number of early childhood programs that serve those families in rural areas. There are about 135,000 early care and education providers across the country that serve families in rural areas. Most of those being comprised of family, friend, and neighbor care providers, and some licensed family child care providers in rural areas, and of course, child care centers, serviced by programs like Head Start, public pre-K, and then community-based child care centers as well. And we know working at those centers is the early care and education workforce. This is a really critical component, and I know we'll spend some time talking about the care workforce today. We know a lot about the characteristics of the workforce. And one point that I'll just note is that obviously there's a lot of variation in both their years of experience working with young children, their levels of education, the wages that they make, and other workplace conditions, like the number of them that work another job for pay to earn enough earn enough to support their families. Finally, there are also some interesting facets of rural early care and education that make it sort of unique. We know that across the country, families in rural areas are more likely to need non-standard hour care, which means that families might be working weekend shifts or overnight shifts and still need care for their children during that time. Center-based programs in rural areas tend to serve fewer infants and toddlers, or fewer of them serve infants and toddlers than centers in urban areas. And we also know that search for childcare in rural areas can be difficult. So in national surveys, about half of families who said that they've searched for childcare in rural areas have had some or a lot of difficulty, or when they searched, they weren't able to find childcare at all and abandoned their search for care. So I've posted some resources to the Smart Start conference session page, so you can go here to find some of those facts that I shared, as well as the source material. I think that's it for now. I'll pass it back to you, Seth, to get us started with the conversation.
Thanks so much, Mallory, for that data. Really helpful to ground in kind of the current reality you're seeing in the field. And for myself, my name is Seth Saeugling. I'm a co-founder at Rural Opportunity Institute. We're based in rural Eastern North Carolina and focused on supporting people's healing from adversity and trauma, and focused on building resilience skills, rooted in a lot of the research around adverse childhood experiences, and just very grateful to get to do this work in a rural community. So to kick it off today and really open up our conversation, we know that rural communities are not one size fits all. They're very diverse, with many different aspects and complexities within each different community. And we often hear about the challenges of rural communities, but I wanted to start today's panel by asking about what are some of the strengths? What are some of the assets? And I might open it up, Khari, if you want to take that first.
Got to get off mute here. Thank you for the opportunity to weigh in here. So I appreciate what you said about the fact that not all rural communities are exactly the same, and that's right. So I would suspect that the strengths and assets may vary a bit as well. One of the things that I would point to is the fact the net migration rate, at least of many rural communities, and certainly the ones where we operate, is positive, which means that there are fewer people who leave those communities, right, than actually come to them. And what can be good about that, what can be strong about that, or important, is that the workforce doesn't turn over very much, right? And so which is a good thing. So now you can really build out service models, and they can really take root in a way, and you can develop them over time because you don't have a lot of turnover with your workforce, number one. The second thing that kind of goes hand in hand with that, I think that's also important, is that you also have the ability to develop approaches for service that are more authentically aligned with the needs of that community, right? Because you have people who are informing the design of that program model, again, who are from the community, who have been raised in that community, and who will stay with you for a good long time. So I'll just stop there, but just say that the people, I think, are the greatest assets of the rural community.
Really helpful framing. And Magda, would you like to build on that? I think you're on mute.
Sorry.
No
Thank you. One thing I find that is a really significant asset in our community, which is extremely rural, is that there are really strong connections among the people. As Khari said, people stay here because they want to live here, and that's a significant strength in the community. The family connections are very strong over generations. Their work connections are strong. People tend to stay in the position they're in as long as it's stable for them. The faith communities are very strong, and the churches provide a really strong base for outreach, for connecting with families, for providing that introduction to our services. People are involved in a lot of different ways in the community, and so it's up to us to sort of seek out those other civic organizations where they are, but those do a lot of work to support the community in different ways and fill in the gaps of the services that don't exist more formally. And then in addition, in a rural community, the geographic connections are also very strong. So while people may not live right next door to each other, they know who their neighbors are. They know each other well. They look after each other. And so these connections make for very strong communities that know each other very well.
Thanks so much for sharing. Yeah, it's interesting to think about how a lot of the research that's coming out around family supports, tight-knit communities, really lines up well for some of the assets you're mentioning in rural communities, and that those components can really support healthy childhood development. Very helpful to ground us to start today. So building off of that, ensuring that each child, especially in their early years, has equitable opportunity to high quality childcare, healthcare, and the family support you're mentioning is just so important. But we also know that achieving equity can be really difficult in any community, urban, rural, wealthy, not wealthy, and not just our rural communities we're talking about. And so as we dig in today, what should our audience know about equity in rural communities?
Well, we've been talking about equity for a while in Smart Start and in the early childhood field, and we've all seen the popular graphic that shows the difference between equality and equity, and providing everyone the same thing and providing different things so that all the children can see over the fence. But the reality is that equity means different things to different people. The easiest definition for me, equity is meeting people where they are. Equity in a rural situation is not the same as in an urban situation. Equity with this family is not the same as equity with the next family that we meet, because when we're trying to bring people what they specifically need, we have to adapt to each family. And so for some people, this makes the discussion of equity complex and a little bit difficult to grasp. For me, the easiest thing is to really just think about giving each family and each child what they need to reach their own goals, what they need to arrive at the place that they want to arrive at.
Really helpful. And Todd, do you mind building on that and kind of speaking to the rural demographics and how you think about that in your work at the Rural Center and any overlaps with equity?
Yeah, and I think it's really great points that are being made here. One of the things we notice we count 80 of North Carolina's 100 counties as being rural, and we see great diversity in those counties. In the aggregate, we can look at the discrepancy sort of demographically between the entire state and those rural counties, and there is some, the rest of the state is more diverse, but maybe by not as much as what some people think, as what the public perception is. Roughly in North Carolina, there's 63% of the population is white compared to 67% in rural. So that's a 4 percentage point difference, maybe not as much as what some people think. The African-American population across the state as of 2018 is 21%, and it's 19% in rural. But I think when you start to disaggregate those numbers from that 80 rural counties, what you see is an incredible amount of diversity across those 80. There's 21 quote unquote majority minority counties in North Carolina. 18 of those are rural. I think maybe a lot of people may not recognize that. And I think once you start looking at individual counties, you see a wide spread of diversity across those counties. Robinson's the first one that comes to mind, where you think of being one of the most diverse counties, not only in the state, but in the Southeast, where you have 40% of the population that is Native American and 24% that is African American. But then you also have sort of nuances to that. If you go back to my home county of Randolph County is about 74% white and about 11.9% Hispanic, which is above the state average. If you go to the other end of the state, there's Berkeley County, which has a large African American population. I think almost up at 69%. Don't quote me on that, but it's pretty high. So I think the thing that I would add on to what's being said is, one, rural places are more diverse than maybe we think, and that maybe we see in the larger public narratives. And two, they're all different. So I think when we talk about equity and approaches to equity and providing resources to expand equity, we've got to think about something. We've got to think about each of these counties and places being different, as Magda said. It's easy to slip in with rural a one-size-fits-all solution. And I think that is where we run into problems, right? So we've got to think about these places as individual communities and not an aggregate statistic.
Really helpful. And Todd, you shared on our planning sessions for today, you shared some really interesting stats around just the overall size of our rural population in our state and the number of towns. Do you mind sharing that for our audience?
Oh yeah, I'm happy to. And I think a lot of people are kind of surprised that, and I shared on our call as well, Seth, with Mallory particularly, is rural in North Carolina is not like rural in North Dakota. We have a very, very dense rural population here. In fact, we kind of are a state of small towns. So we have about 4.2 million people that fall into the rural classification of the rural center, which is 250 people or less per square mile. We have the second largest rural population in the state behind Texas, and we have the second largest number of small towns behind Pennsylvania. So you're talking about 4.3 million people, 80 counties, and about 84% of the state's landmass. So we are very much, both in history and in current demography, a rural state.
Thanks so much. Yeah, I had no idea until you shared those statistics, that just the breadth and size of our rural communities, and I live and work in one. So just really helpful framing. Thanks so much. And then Mallory, do you have anything you'd like to share, bringing in the connection to any data around childcare and equity?
Yeah, I mentioned one in my introduction that I think is often overlooked, but there in early childhood are inequities by the age of child. So as I mentioned, it's much more difficult in rural areas and much more difficult in general to find care for infants and toddlers because the cost of care is so high. And it makes the economics of providing care for infants and toddlers very difficult for rural areas, where we might talk about this later today, where sort of the economics of the model just don't, it's just so difficult for a provider to make a business out of it. And so what we see is, because of the trend of larger influxes of public funding towards 3 to 5 year olds, infants and toddlers are sort of left out of the mix. And so we can also think about inequities in terms of ages of children served in that context. I just really wanted to appreciate what Magda said earlier about kind of meeting people where they're at. And I think that's a good solution as we think about families as well for their early care and education needs, because we also think about, parents' needs, parents' work schedules, children's development needs, which are all different based on the family structure and the family's goals. And so I just kind of wanted to reiterate that's a lot of the way that we think about equity as well, that really the characteristics of you as a person or your family or your community shouldn't dictate your outcome. The solutions are really going to be unique to each of you.
Thanks so much. So really helpful framing from our panelists so far of some of the assets of our rural communities, and then some thoughts on the complexities of what equity means in practice. So we're going to transition here into our next part of the program around digging into what's at stake and what are some of the biggest needs in our rural communities. And so Mallory, I'll keep you on the hot seat here. And from your perspective, what is the greatest challenge in providing quality, accessible childcare in rural communities?
Yeah, this is a good question. One of the resources that I posted to the session page was a recent paper that some of my colleagues have put out about a more comprehensive and family-centered definition of access. And we're in the process of at Child Trends doing this type of more equitable centered approach for definitions of quality as well. But really, when we think about access to childcare, it's not just about location and it's not just about cost. We have an added definition of there needs to be a reasonable effort for parents. What we ask of parents often in finding childcare is not at all reasonable. It's very difficult to find where providers might be located in their area, who has a spot open. I mentioned earlier in the introduction about parents who might need care outside of typical 6 a.m. to 6 p.m. childcare center hours. That can be very difficult. And for families who have a child with a disability or a special healthcare need, for families who speak a language other than English at home and would prefer their child have language other than English from their childcare provider as well, that can be very difficult. So we think about this access issue as being about location and cost, but also being about reasonable effort for parents and just meeting their family and child's needs.
Very helpful. Thanks so much for sharing. And Magda, on the same question, do you have anything you'd like to share around just when we think about the needs, how potentially your experience you've shared around being excluded from certain opportunities?
Yeah, sometimes it's difficult. In a rural community, we have to compete with some of our neighbors when we look for financial support locally. It's not just focused on our own county. The large employers, the large corporations, there aren't very many, maybe located on the border of the counties. They draw their workforce from across several counties, so they want to spread their community support. So we have to compete with them. We also compete for support for resources in the community with other small grassroots organizations. It's really hard as Smart Start, which is, you know, relatively well funded by the state, to compete with local, small grassroots organizations for the limited funding that's available. We also compete with other partnerships so that when statewide resources become available, for example, through NCPC or the division, we have to compete with other rural partnerships, larger urban partnerships for the limited resources that are available. So that becomes an issue when we're looking for additional resources.
Thank you for grounding us in what you're seeing leading a Smart Start in your community at a county level. And then Todd, can you zoom us out a little bit at a statewide perspective, thinking about some infrastructure challenges?
Yeah, and I think Magda hit the nail on the head. The Rural Center does not do education per se, like some of my esteemed panelists that are on this call with me. So I want to be careful that, you know, we don't dive as deep into this issue as they do, but I think what Magda said is a universal truth when it comes to rural places, and that is this issue of capacity at the rural level and this economies of scale. So, you know, when you think about larger issues that are affecting community, it looks a little different in a urban area. So the example that comes to mind is something like broadband, right? It's easier to run cable for broadband, fixed wire fiber in an urban area. It's harder when you come to a rural area and you've got, you know, significant distance between folks and towns. And so you're faced with that challenge, right? And to Magda's point, this capacity issue is a big problem. And it's, in some ways, it's created a zero-sum game mindset for rural places, in that they feel like, well, if this town over here is competing for this and they get it, I've lost out, we've lost. And one of the things to address that economies of scale and to help rural communities think more regionally, we talk about regional capacity building. And instead of you as a town with limited resources, maybe limited staffing, trying to solve an issue, turn that problem from a community issue, a county issue, into a regional issue, and then address it that way. And then you still have the issues of economies of scale, but you've also combined capacity and resources in a way that you hadn't before. So I think, you know, what Magda said is true for the work you all are doing, and it's just true. It's a universal truth for rural communities in general across the board.
Thank you for that context. And so building on what we're talking about so far, thinking about the whole child, you know, education, health, all these different factors, we know that many of our rural communities also struggle with access to healthcare. And so with that in mind, what other infrastructure is important for children and families in our rural communities? And Khari, do you want to lead us off on this one?
Sure, I'll be happy to. And if I want to quickly also just kind of parrot what Todd and Magda said as well, or just to at least give an amen here to the infrastructure, the IT infrastructure challenges. I agree in what Magda was also talking about in terms of just the challenges with competing for resources, funds, and all of that sort of thing. I'll just also point out that I think one unintentional consequence on the funding side is that sometimes you'll have grantors who will put certain conditions on the funding, like that you have to have, I'm making this up, or maybe I'm not, but you have to have a university, for example, that has to be a part of your collaborative to be eligible to get the funding to move the work along. But you know, your nearest university is literally 200 miles away from where you do business. That sort of screens you out in a way and sort of makes it difficult to compete. But going back to the idea of some of the challenges, and I think some of the collective opportunities, I would just also want to underscore these couple points. One is that the cost to actually deliver on the model that you know will be successful or help you be more successful to improve outcomes for children and families is a challenge or a barrier, right? I mean, my agency does, we have done extensive research, plus we pull in the voice of the community about what's needed. We know, that's why we've added a licensed nurse to our staff model. Well, that costs money. I mean, you know, in most of the places where we operate, the access to healthcare is so abysmal that we include a nurse in our service model for Head Start and Early Head Start to help grant that access, for example. We also know that, for example, that smaller class size, smaller class sizes and also smaller group sizes within the classroom tend to deliver better outcomes for children who or live in rural circumstances. Well, to make that happen, we actually have to overstaff our room. We don't just have a teacher and teacher system. We have others to lower the staff-child ratio. That costs a lot of money to do that, right? And so those are some of the challenges that get in the way. But what I'll end with this point, that that part of the collective opportunity for us is coordinating in a smarter way with other providers who do similar work in these communities, so that we're not leaving any children out by recruiting in the same places or not making slots available more broadly for children and families to be served. So we're not competing for the one and same child. And so that's one way to kind of help with the equity access as well. Sorry for the long answer.
No, sorry. Such rich information, especially just grounded in your practice of the different centers across these different rural communities. So thank you for lifting that up. And Todd, based on what Khari's bringing up here, is there any other things you'd like to elaborate around infrastructure?
No, I agree with everything Khari said. And I would just add on to that, you know, we think about infrastructure going back to this economies of scale issue. And we had a great comment in the comment section that I would like someone point out, that regional capacity building is hard because of geography. That's absolutely true, particularly when you talk about broadband. Broadband's harder to do in the western part of the state, given geography, than it is in the eastern part of the state. Again, going back to that, understanding the particulars of the place you're working in. One thing about infrastructure, and as I see it relating to childcare, is, you know, in early childhood education, is there's a lot of factors that go into a child's ability to learn. And Seth, you and your group do a lot of work around this. And we have to think about access to healthcare being an issue in rural places where we've seen more rural hospital closures than we would like. And certainly when you talk about the mental health care aspect of healthcare, access to a psychiatrist in rural places sometimes is really hard to come by. So if you think about, you know, holistically the child and setting the child up to learn, you've got to think about these environmental aspects that influence that. And that's, you know, wastewater and water infrastructure is a big issue in rural places, the aging water infrastructure. Not technically an infrastructure issue in the traditional sense, but I think we're on the cusp of having to take a long, hard look at housing and access to affordable housing in rural places. It's been an issue, and it's going to be even more an issue. We've all seen the news about housing demand versus supply, and I think in rural areas, that's something collectively we have to look at. And again, it's not an infrastructure issue per se, but it almost is a systemic issue we've got to figure out.
Very helpful. And then Mallory, how would you recommend our audience thinks about what to do when economies of scale maybe doesn't work, or we have some of the breakdowns when we think about this idea of scale?
Yeah, and this is a conversation that is so essential at the community level because it's rooted, as we've been talking about, in what the community strengths and assets are and what their unique challenges are as well. But to have this conversation as community leaders about when economies of scale don't work, whose responsibility is it to make it happen? And some of these we've brought up already, like private philanthropy funders have a role, state and local government and federal government have a role, and that the size of those roles will be different depending on what your community needs are and depending on what type of assets you have. But it's just an essential community conversation in rural areas when the way that it's set up is not going to work for you. Like who's going to take the charge and lead it, lead you to making it work, because families in rural areas deserve it and need it.
Very, very helpful. And so the last few comments and conversations we've been having are really kind of framing up this what's at stake and lifting up the needs in our rural communities. We're going to transition here into talking about our collective opportunity and any specific strategies that we can walk away from today advocating for and being aware of and spreading the word about. So building on that, what policy changes or systems level changes would be most impactful for children and families in our rural communities? And for those, especially for those who care for and support children, when we think about that 2-generation approach. And would love to kind of turn it over to you, Khari, just based on the breadth of experience you have with your work.
So that's a tricky question. You can get me in trouble talking about policy changes, Seth. But here's my humble view of that. So I did touch on one of those, and in my last comment about the importance of those of us who operate in rural communities not to compete with each other for children and families to serve. I mean, there are already precious few, as in my view, there are already precious few slots for services to begin with. So there's no reason why everyone can't deliver on the service that they are trying to. So I think we need to do a better job coordinating that. And I think having some policies, some early childhood or education policies around that to kind of help govern that, I think will help. So that's one thing I want to point to. Another one I think would be important, that a set of policies that might help us to do a better job of building out our workforce, right? I mean, I see that actually as an infrastructure issue as well. Earlier, I said that one of the great things about working in rural communities is that your workforce doesn't turn over very often, and I still stick by that. But there is another side to that coin. The other side to that coin is that you also don't have the talent pool growing as rapidly because not as many people are moving into those communities. So now you're sort of stuck in this place where you don't have a larger pool of talent to draw or recruit from. So I think that we would all benefit by having some policies that would incentivize some talent, some additional talent to come into these communities. And then some of that, you see that in Teach for America and programs like that. But I just think having a more coordinated set of policies can help address that issue as well. So I'll stop there.
Very helpful. And Magda, you and Khari lead very similar, important, impactful work. You in Warren, Halifax. What are you seeing in this area?
I agree strongly with Khari about our workforce and finding ways to support the workforce and provide a living wage. When you live in a low wealth area, the parents can't pay a lot for the care. And so they're not paid well in their jobs. They don't have a lot of income to pay for the childcare. Teachers don't get paid well. It's a challenge. Another area that I feel very strongly about is the evidence-based projects that we have at our disposal to try to implement to support our families in the community. Most of the evidence-based activities are developed in urban areas. And when they get to a community like mine, we don't fit the basic parameters of the model. We don't have enough large centers, so we can't apply this model in our community. We don't have enough families to have at least 15 parents in a group in order to provide this model of family support and parent education. We don't have, our caseloads are too big or too small to meet the model. So for example, in our area, when we went to do nurse-family partnership, first we had to get over the competition for families, as Khari pointed out, because people at different levels said, well, I'm not going to have enough families in my program if these families go to nurse-family partnership. Then we had to look at meeting the parameter of minimum number of births. We had to pull together 5 counties in order to reach that minimum number of births, have 5 nurses and a supervisor. We were the first in the country with NFP to do that. So we need a lot more evidence-based interventions that are born in rural communities, that start in rural communities and live in the reality of a rural community with the time and the distance to travel, with the lack of transportation, with the fact that somebody providing home services may travel 4 of their 8-hour day is spent in the car just to serve 2 families. That's, and then suddenly that becomes not cost effective to a funder.
Incredibly helpful. And just so I want to make sure our audience got it. Magda, I feel like that was a great example of some of the themes that Todd and Mallory mentioned of regional collaboration. So, I mean, the Smart Start partnership in Warren, Halifax, I mean, you are the first in the country to build this 5-county region to get to the scale and the economies of scale to be able to access this evidence-based program with Nurse Family Partnership that really is like the gold stamp of, I mean, they've done all the double-blind studies to show that they improve outcomes for the parents, they improve outcomes for the kids along a whole myriad of healthy development. So just thank you for lifting that up and just trying to connect it back to what people shared earlier. And then
our collaborators, if I can just point out, was not just early childhood. It actually was born out of the courts and the youth, trying to address the issue of the number of youth involved in the courts in our community that brought it up first. And then Smart Start and the health departments and extension and the schools and all of those partners together.
Thank you for lifting that up. And that's even an incredible thread back to the assets that we began with of the collaboration and willingness to help one another across these different agencies that really led to this really important program existing in your community. And building on that, Todd, kind of the conversations you're hearing right now, what would you tell our audience about philanthropy and what maybe you'd like to see how philanthropy could better support the needs of our rural communities?
Yeah, well, I'm just going to reiterate some of what Magda said. I think one of the things is, typically, and let me preface this by saying this state that we're in, North Carolina, has just an impressive, and I think sometimes we take it for granted, philanthropic support system and history of philanthropy. And at the core of that has always been rural North Carolina. If you go back to the founding of the North Carolina Fund by Governor Sanford, rural was a major part of that, and it changed rural people's lives. So I say all that to say, we have wonderful philanthropic support in the state, but to Magda's point, typically going back to kind of lumping all of rural into one data point, we sometimes take what is an urban response that may work in an urban area and then try to overlay that onto a rural community without fully understanding the nuances of that place. So what I'm sensing, Seth, is, and I'm sensing philanthropies are aware of that and they're responding and they're trying to think about how does something that work in an urban area may not translate into a rural area, and sort of understanding those assets that are in that community and kind of moving away from that mindset of rural as a problem to be solved, and it's an opportunity to be unlocked. So that would be my response.
What a helpful mindset shift for us to hold on to. Rural is not a problem to be solved. It's an opportunity to be unlocked, and just could be applied in so many ways to the work we do in communities. At Rural Opportunity Institute, we talk about a lot that there aren't deficits in people. There's deficits in the systems that have been constructed around people. And that we just know inherently we as humans are wired for healing and connection. So just appreciate you lifting up that lens. And Todd, I'll keep you on the hot seat here. I think of the Rural Center as just a major player in economic development. And so a lot of the conversation we've been having is around education and around health. But when you think about how we can better support rural leaders and this idea of better early childhood policies, for you and the Rural Center, how does that connect to economic development?
But it's a great question, and I am bullish on rural places, but I'm also clear-eyed and sober about the challenges that face our rural communities. And I think we need to be honest that One of the things we do at the Rural Center is leadership development. We've been doing it for nearly 30 years. The thing rural places have to understand and get around is the diversity I just talked about. That is not always reflected in local leadership. And I think we've got to figure out as rural people in places, how do we get in, if you disaggregate the data anymore and you get into the younger demographic, those places are even more diverse. So we've got to think about how you bring up those leaders who are going to help that community that you love survive, right? And we need to understand that for that small town that you were born in, raised in, that your family's heritage is in, the next leadership may not look like you and may not have the same accent as you. But we want these places to survive and grow. And I think we have to tap into that next generation of rural leadership and start equipping those leaders to lead those communities into the future.
Find leadership in unexpected places. So the other component of the connections in our community is someone you interact with professionally may not be in a leadership position, but they may have a very strong leadership position in their church, have experience, and have the talents it needs to marshal the community and resources in the community. So you have to be open to different sources for that leadership.
Can I add to that point, Seth? Magda, you are spot on with that. In fact, what you're describing is that there's a set of terms that I use to describe what you're talking about. And the way I say it is that I believe that in the world of leadership, there is called leadership and there is installed leadership. And the installed leadership, those are the ones who are in those positions, right? And for, they're in those jobs and they have them and they have those roles for whatever reason. Maybe they earn them, maybe whatever it is. But called leaders are ones who might not necessarily officially be in the position, but they have an orbit about them and they have real influence in the place where they are. And so you still have to respect and honor the called leadership structure in these communities, because that's how you get things done as well. It's not always the installed leaders that are the drivers to change. So I think that's an excellent point you're making.
Incredibly helpful distinctions here. And the theme, Khari, Magda, Todd, I'm hearing of the mindset of an organizer, looking for leadership in unexpected places. I love the distinction between installed leadership and called leadership, and Magda just having an eye and awareness of there might be deep leadership among us that we might not be trained to look for and see. We might need to change our perspective to find that. Incredibly helpful. And then Mallory, kind of tying up this theme of economic development. Is there anything you'd like to share around how you think about childcare data and economic development?
Yeah, absolutely. So I think there's been a long recognition of the importance of childcare specifically for parents and families to be able to work in rural areas, and a kind of emerging benefit to children's development. One thing that has come a long way in the last 10 years is data about childcare for use as a planning tool for economic development professionals. So I have a couple of resources that we can put in the chat and that will be available online. Some colleagues that I have now that are doing more sophisticated mapping techniques about where childcare providers are located relative to families. You can disaggregate that by all kinds of census tracts, so you can make sure you're tracking equitable access for different race and ethnicity groups or families with different work schedules and things like that. So just to offer that there's so much sophisticated and usable data right now about childcare access that people in economic development can be accessing for their regions. And I'll just say that our colleagues at Childcare Aware of America have been putting together things like statewide fact sheets about those types of access numbers for a long time. And so colleagues now are building on that and kind of expanding the use of that, which is just exciting.
Yeah, we definitely encourage our audience to dig into the link that's been dropped in the chat from Jessica, referencing the really neat data work that Mallory is talking about. We're coming up here, such a good conversation. Hate to even imagine cutting it off, but we have a couple more questions to dig into here. And for our audience, if you have anything that's top of mind, please put your questions in the chat. There will be a Q&A session here at the end, so feel free to drop those in. But moving along here, so we're talking about leadership, we're talking about identifying maybe the unexpected leadership, connecting it back to economic development. It's been brought up before, but just want to put an even finer point on it around community voice and ensuring how can we help ensure that the voices of rural community members are heard and respected, whether that's around how programs are created or around policies at a local or state level. How can we work to ensure that voices of the people we serve and community members are better incorporated? And Khari, I'd love to start it off with you based on your work.
Sure. I mean, just quickly, I would say that I personally believe that it's a posture of arrogance for anyone to endeavor to provide services to anyone or any community and not get the voices of those who you are that you're thinking you're going to serve. So I mean, and in the medical field, they also say what is it? Treatment without diagnosis is malpractice, right? I mean, you should not be doing that. So so for us, it's a little easier, I would say, on the Head Start side because it's kind of baked into the Head Start model from the beginning, right? We are required to have policy councils that are that 51% of that representation has to be parents of the children you're serving. The other 49% can be community members and should be. So for us, it's kind of built in, but I would just say that some semblance of that, I think is the way to get there, is to have a policy group that actually advises you on the steps that you plan to take. And then the last thing I would just say is that I'm still a big fan of tapping into key informants through focus groups. And I think doing that on a regular basis, I think is another way to sort of get at it.
Very helpful. And Mallory, I feel like this overlaps a lot with your work. Would you care to expand?
Yeah, well, as we are often tapped to be evaluation partners for new initiatives or interventions happening in rural or urban spaces. And I can say that the power of community voices throughout the research process, even defining what do we really want to know about how this is working, that might be somewhat dictated by what the funders of that initiative want to know, but asking the community members what they want to know and having their input in designing the study and also gathering data and information and then compensating them for their time for doing it. We're no longer in the days of you can just expect people to take a survey, an hour-long survey for you just because you ask nicely. So that we're also thinking about being stewards of equitable participation in research and evaluation. So similar to how you would develop a program, how you go about evaluating it and understanding its implementation, the voices of the practitioners and the families involved are just so critical.
Incredibly helpful. And Magda, touching on the kind of diversity that has been a theme throughout today, thinking about, we haven't really yet touched on the rich diversity of Native American communities and tribal communities across North Carolina. Wanted to make some space for you to connect here.
Thank you. Yeah, we're in a, I can't say completely unique situation in my community because there are 8 tribes recognized in the state of North Carolina, but in Halifax, Warren, we are the home of the Halawasaponi tribe, very strong community in our area, them within themselves within the larger community. They work very hard to support the needs of their community for their community. There's a tribal school. They were one of the first 100 charter schools. They operate their child care center. At one point in time, they operated, many of us are familiar with the Baby Love program. They had their own grant to provide baby love in their community. And it's a strong community for us to work with, not for, and not at, but work with in order to integrate into the services that they already provide in their community. It's a strong segment of our community, and one that you know, we've spent a lot of time trying to cultivate that relationship.
Very clearly hearing the value of collaboration and honoring kind of inherent leadership and honoring sovereignty. Thank you so much for lifting that up. And then to our audience, please feel free to put any questions in the chat. We will be coming up on our question and answer session here in about 5 minutes. And Mallory, a point you made, I just wanted to lift up also around compensating community members for their time when they are informing program design or when they are giving feedback and doing evaluation activities. At Rural Opportunity Institute, we have an organizational policy to compensate anyone who is not paid to be there. So what we mean by that is often when we're having a community meeting or when we're having a focus group, there are many people who, you know, as part of our professional jobs, it's our job to be at that table. And when there's a parent or a community member who's at that table that doesn't have a formal salary attached to them being there, it's on us as the organizers to make sure to compensate them. And often that's done in a more subtle way. It's not necessarily like, raise your hand if you're not paid to be here and we'll make sure to get you a gift card, but it is done as a one-to-one, a thank you for being here. We really value your time. And then just for the audience, important to think about like how you're compensating people. Gift cards have been a great tool for us because it can be considered a gift. And if it's under a certain amount, that's not a taxable event at all. So just things to be aware of. If you give checks to people, sometimes there can be a 1099 contractor tax burden with that. So happy to connect with anyone on those nuances, but just think it's a good point to lift up. And then moving into our final question here, this idea of adverse childhood experiences and this idea of how research has been coming out over the last 20 or 30 years that stress in our environment can really impact us at any age, but especially in the early years as we're developing. And the public health crisis known as ACEs, as adverse childhood experiences, and kind of the cycles of trauma that are very real and have been real for humans since the beginning of time. Question here for the panelists is, what strategies can we use to support resilience building in rural communities? And Magda, I'll turn it back over to you.
I feel really strongly about this. This is a really significant portion of our work. And one of the components that we are still working on is how to address that for the adults in our community. Because as you pointed out, this is newer research in the last 15 or 20 years in terms of the best way to deal with it in children. But when we bring it up with families, it brings up a lot of issues with the parents that perhaps were not identified for them, with the teachers, perhaps have not had the opportunity to identify their own issues with trauma. And so we need a lot more support for the adults in the families that we're working with so that we can properly serve children in those families. And the mental health system, those of us that have been doing this for a while remember mental health reform and what that meant. And in my community, we had things here. We had professionals here. And with mental health reform, then we had none, literally. No psychiatrists. At one point, we had no speech therapists. We had no, those, and our mental health agency that serves 25 counties now and goes as far as Durham. The office that, we fall under is over 50 miles away. So as a recipient of their services, all of those things we talked about come into play, and us being able to provide those services. So being able to look at ACEs as a family issue and that it applies to everyone in the family. We can't serve the children in isolation of their parents. Teachers can't serve the children in isolation of themselves.
Really clearly hearing the idea of if we're going to, if we're trying to focus on resilience building strategies for children or youth, it really is a 2-generation approach, or it really is a looking at the whole child, the whole family system. How can we support the adults and the caregivers to get support around whatever stress is potentially impacting them also? Really, really helpful. And then Khari, from your work and perspective, what are you seeing around resilience building strategies, especially from birth to 5?
Thank you. For the sake of time, I just want to say amen, amen, amen to what Magda said. So she is, she hit it. I only want to just add two, just 2 other ideas, but I want to underscore what Magda said. So what I just want to point to 2 things. One, going back to access, right? It is very health professional access. It is very difficult to get the numbers of professionals that mental health consultants and others into these areas where we operate to actually help us sort of wrap those services around that whole family that Magda's talking about. So I would just point out that the children and families that we serve often do encounter real issues in their lives in these communities, but we're having difficulty finding that support. But I'll point to 2 things. I mentioned earlier that we have tried very hard to embed some international research on rural communities and to distill that down into a model to help us with these things. So one thing is that we have learned in many of the communities where we serve that something that helps, in addition to the mental health consultation with ACEs, is having indoor learning environments, fancy way to say classrooms, that are more naturally built around more natural colors. So all of the bright primary colors that we tend to go with in early childhood spaces really is not, it's overstimulating in many ways. And so we have shifted our model to a more natural thing, and natural light, natural colored furniture. That is one thing that helps. Costs a lot of money, but it helps. And then the second thing I want to point out is that for us, we make special commitments. Remember now, we're hiring, we try to hire from within the community, which sometimes includes even hiring the parents of the children that we serve. So that means that our workforce often faces adverse experiences as well. So we have built in what we call, we didn't coin the term, but mindfulness spaces in each center where we operate. These are mental wellness spaces where people can de-escalate and meditate and relax, and in some cases even receive massages, but things that sort of help with the anxieties that come with ACEs. Very expensive to run, but we built that into our model as well.
Incredible. Yeah, it seems like a strategy that works really well for early childhood education that could apply almost anywhere, corporate settings, health, I mean, any sector, government, the mindfulness spaces and the de-escalation, the mindfulness techniques, the evidence is so strong and the wisdom is so ancient. So really, really incredible that you've built that into your model. And then Todd, when we think about resilience strategies, is there anything else you'd like to go deeper on around thinking about philanthropy's role in that?
Yeah, well, I've just been fascinated by this discussion. I feel like I'm learning as much as anyone listening to Khari and Magda and Mallory talk. One thing I would add is, I think by nature, and this is coming from my perspective working in economic and community development, is that rural places are inherently resilient by nature. If you look at where most of our natural disasters hit, Seth, down your way, the historic community of Princeville, they are more prone and susceptible to the long-term effects of a natural disaster, and it's a longer recovery for many of them. It's the same is true for the economic recovery as well. One of my colleagues at the Rural Center likes to say when metro urban North Carolina catches a cold, rural catches an economic pneumonia. And it's harder for those places to recover from that. In fact, there were some communities that had not returned to pre-Great Recession levels of economic activity before COVID hit in North Carolina. So you've got to think about, one, you have this natural resiliency that's foreign, you have this economic resiliency that's foreign, and I would say there's a historical resiliency as there as well, given that these communities come out of an agricultural economy. And we know there are tons of pressures in the agricultural industry, and a lot of resiliency and trauma can come with that as well. So I think, going back to your question, I'm sorry to be long-winded, but I think like I think thinking about rural communities, when a philanthropic approach to that is understanding that many of these communities, this dedication to place sometimes is reborn out of resiliency, right? They're sticking in there, they're staying with there despite the economic downturns, despite the natural disasters.
Yeah, really, really helpful grounding, and just resonates deeply what you're saying. Appreciate you lifting that up. So to our wonderful audience, if you have any questions, now is a great time to share them in the chat. We'll give a moment to see if any questions come in. I know I've just, like you said, Todd, I've learned a ton from each panelist individually, and just really, really rich discussions. And as we wait for questions to come in, would like to just open it up here. I have two closings, and they're a little shorter, but just if thinking kind of action oriented or just simple, more simple than anything, would like to invite the panelists to share, if you just had one push or one takeaway that you wanted an audience member to walk away from today, what would that be? And I'll feel free to open it up to our panelists.
Seth, can I throw out a data point there? I'm sorry, Khari, go ahead. I just want to put one data point out there that I think gets at to some of the disconnect in the state that we see between urban North Carolina and rural North Carolina. One of my colleagues at the Rural Center did some data mining of the 2013-2017 ACS American Community Survey 5-year average. And we found it really fascinating. And what we found in this state was that at that time, 43% of North Carolina residents were born out of state. And when you disaggregate that, it's even higher in urban areas, which is upwards of over 50%. But in rural areas, it's only around 35%. And I think what we are experiencing in the state, what used to be a really familiar urban-rural connection, city cousins, country cousins, we've kind of lost that connection and that point of perspective. And I think, as this state continues its great economic growth, and as it recovers from this pandemic, I do worry about us losing that connection between that sense of respect, that sense of an accurate portrayal of each community, and it works both ways. And I think we've got to find some way to get back to that. So I just wanted to leave with that data for you.
Incredibly helpful. Thank you so much. Khari?
Yeah, I'll jump in. I was just going to actually just highlight two things. One thing, the thing that Todd said earlier, I think you said that something like rural is not a problem to solve, but an opportunity to unlock, or something like that. I mean, I think that is golden. I mean, that is that. I love that. You will hear that again from me at some point. So I think that's great. And then the second thing is just this idea that we have to understand that the rules of engagement for building a well-qualified and well-experienced workforce is not different in rural communities from what those rules are in urban communities. We still need to be able to compensate well and train well. That there's no exception there. So we have to remember that. I just wanted to raise that.
Thank you so much. Magda?
I agree. And I think that we spend a lot of time talking about our challenges and the barriers and the things that we need to overcome, but we need to spend a lot more time talking about assets and the strengths that we have, and develop those services and projects and interventions that are based on those and that work in our communities organically, that are not other designed in other contexts, and then we try to tweak it this way and that way to make it work here. Well, what if we do this? How do we do this? We need to have the opportunity to develop those services to meet the needs of our community, to meet people where they are, to provide those services in an equitable fashion based on strengths and assets of our community.
So helpful. Thank you. And Mallory.
So I want to go back to what Khari said about compensation. A lot of the work that I do is around the ECE workforce. And as everyone knows, compensation is top of mind for that workforce in particular, in addition to their well-being and making sure that they continue to earn credentials and degrees that help them care for young kids and their families. One thing that we haven't talked about today that I want to make sure is just said is the role of institutes of higher ed in rural areas, and not just thinking of those as an urban asset and the responsibilities of college and university systems to meet the needs of rural communities, because that's certainly true of the early care and education workforce. People need to take courses on child development and health and safety courses and get training that they need, but it's also just necessary for rural economic development in general. So not letting higher ed off the hook, that they have a role of supporting children and families in rural areas as well.
Thank you so much. And then I'm seeing some questions in the chat that feel free, any panelists, to take these. But there's some questions around these ideas of collaboration and specifically grassroots collaboration. Who should be responsible for initiating that? And it says in the chat here, for example, bringing mental health or developmental disabilities together at the line worker level. How or who should be initiating grassroots level connection or collaboration?
Well, I'll dive in. I have to say that's an area where, for lack of a better way to say it, we need to tiptoe a little bit. People's mental health is a very sensitive issue, as they, particularly as workers, are exposed to their own histories in a different way, perhaps, than they interpreted it. We have to find and rely on the expertise of those mental health professionals and make them aware of the needs that we have. Every different collaboration, as I read this question that I've been involved with, has been started by somebody who saw a specific need. So, as I said earlier, in the case of our nurse-family partnership, it was actually the court systems that said we need to nip this situation in the bud. In another one, it was the schools that pulled together partners to try to figure out how to address issues of local access to local food, and people got involved. So depending on the issue, somebody different's gonna initiate the collaboration. And the beginning of that collaboration is always the hard part. It takes a lot of legwork, a lot of calls. You can't just send people an email and say, please come to this meeting. You have to talk to them about what's going to happen, what the purpose is, where it's going to go. That takes a lot of effort.
Thanks so much, Magda. And in your example, a follow-up question. When, in your experience, is it the group that initiates or lifts up the issue is then responsible for making the collaboration happening? Or in your community, if the court lifted up the issue, was it a different agency that actually held it together and made the collaboration happen?
It was a different agency. They sponsored the first few meetings, and the people that were really interested in having nurse-family partnership ran with it. Then came the discussion of who was going to be the administrative entity house it in this 5-county region, and everyone have to play a part. Sure, I'd like money in my agency, but I don't have the capacity to supervise nurses. That doesn't make sense. We'll put it somewhere else. Who has the skills to actually write the proposal? And so that's what real collaboration is that nobody owns it. And everybody is about having that resource in our community in the best way that works in our community, not in the best way that works for me.
Very helpful. Todd?
Yeah, I think Magda's exactly right. I would like to add one thing to that I think is particularly on mental health care and developmental in early childhood, even a potentially untapped resource is rural faith communities. I think we've worked with some who have really kind of, through a program we have called Faith in Rural Communities that works with local faith congregations in rural places to think more about what is their role externally in community and economic development. And one of the ones we worked with partnered to do a mental health support program at a local elementary school. So I think, when we think about anchor institutions in rural places, you think about schools, you think about faith communities, community colleges, and things like that. And I think bringing them into that conversation more opens up more potential assets for these local communities.
That's really helpful advice. Thank you so much for sharing that. And seeing in the chat, thank you, Claudette, for lifting up the alumni members or different fraternal associations living in rural areas often can be supportive or can be some of that collective glue to hold things together. And then I would just like to ask our friends, our Smart Start partners, there's some questions in the chat around the specific links that have been mentioned and getting a link to the session description of today's. So if that's able to be shared, please feel free to share it. To our panelists, as we wrap up here, feel free to share any links about your own organization or anything you'd like the attendees to get access to. And then I'd love to close with just one rapid fire question here for each of the panelists. But I just think the stories that are told and that we hold on to, or the narratives, have immense power. And as someone who lives and works in a rural community, I think often the narratives about rural are just wrong. And so I would like to frame up this rapid fire question for our panelists as, what narrative would you like our audience to walk away with? Or what narrative do you think embodies the most hope or the most strength that would be helpful for us to walk away from today's session with? And we'll hear from everyone and then close it out.
I'll just say that in the context of a rural community, big things come in small communities. Local, the way that our community has rallied during the pandemic, a number of small, probably previously unknown to other parts of the community, have risen up to meet the needs in their community through food distribution, through rides to services, to all of those things. Little small entities in the rural community do a lot of really big work.
And I would just jump in and say, I think that sometimes there are these negative associations with rural. This idea that rural means backwards or slow or behind the times. And I would just say that that couldn't be farthest from the truth. So that would kind of be my follow-up.
I'll go. I feel like we've had the theme of community assets has been such a strong thread here today, which has been refreshing. And I think, so I guess I would just echo that what is kind of core to our fundamental as being people, our relationships, and rural places offer super, super strong, deep, long relationships for people, which makes it a great place to live and work and have a sense of community. So I would just kind of sum it up that way.
I think I would end with a call to folks who aren't from rural places to go visit some rural places. Take some time and spend some time in a local community, find some place on the map, go there, read about their history, and just spend some time, even if it's spending a day walking downtown. I think you can learn a lot about a community. And I worry about, given those statistics I was telling about folks born out of state, that we're losing some of that sense of what is east of the I-95, right? It's a big state. There's a lot of geography east of 95. And it's easy to think you've experienced as you drive from the triangle to the coast. But take a detour, just spend some time, talk to someone at a local cafe and get a sense of what life is like there. And to the point everyone's made here, why do they stay? Why do they love that place? And why do they want to see it succeed for another generation?
Thank you so much. And just a huge thank you to our panelists. I found this conversation incredibly educational, really enlightening, inspirational. Feel free in the chat audience to give gratitude or thanks to our amazing panelists. And just really grateful and enjoyed our time together. So thank you for being a part of this.
Yes, on behalf of Smart Start and all of our local partnerships, thank you so much to our panelists and to Seth for moderating. This was a really great session, I think, for all of us to gain a little bit more insight as well as education.